Steve Pisano, PRMA San Antonio. We're covering some topics that patients want to know about, commonly asked questions. One of them is nipple-sparing mastectomy. Am I a candidate? How do I make this decision? Well, the good news is, in this day and age, nipple areola sparing mastectomies are very, very common, and many patients can qualify, so to speak, to have a nipple-sparing mastectomy. This is a big change in my lifetime of practicing medicine because when I started my career, this was not done. But now we can do it. Why? Well, first of all, when you save the nipple and areola, statistically, studies show that the likelihood of a recurrence of breast cancer is really no different than if you take the nipple and areola away. So then what drives whether or not you can save the nipple and the areola? Well, a couple things. One, the size of the tumor. Generally, a tumor that's less than 2 centimeters in size, it's about 1.5 inches, 1.75 inches, and then a tumor that is greater than 2 centimeters away from the nipple areola complex. So an outer tumor, upper tumor, for example, would be favorable. And then the rest of it is just a personal decision. Some patients want to save the nipple and areola for the appearance of the breast, to keep that native structure. It will help give better sensation. The sensation may not be quite normal after the mastectomy, but it certainly will be better than if the nipple and areola are removed. The other part of that personal decision is the comfort level of the patient, you the patient. So when you save the nipple, you're saving a little bit of duct tissue because there's ductal tissue coming through the nipple that would bring milk to a baby at that stage of your life. So when you do a nipple-sparing mastectomy, you're saving a little button of duct tissue. It has to be thick enough under the areola so that it has circulation and survives the mastectomy. So these are some of the things that come into play. But many patients now, again, this is the key point, are a candidate for nipple-sparing mastectomy.